top of the hour at 2 o'clock. So for those of you who are able to join us early, thank you for playing along with the trivia. I do want to drop a link into chat for everyone. If you are interested in following along with the presentation while we are presenting it, there are many links and things that are available in the presentation itself. I do encourage you to open up the link that's on our website so you can go along with the presentation and even access some of the resources that we're going to be discussing today. So I have dropped that link into chat for folks, and hopefully you're able to see that. We are going to get started, and I just want to welcome everyone to our annual meeting of what we refer to as the Network Council. And this Network Council, just to describe that for folks who have joined us maybe a little bit later, is all of the dialysis facility and transplant facility staff within the network service area is considered the Network Council, or the council of the professionals that the ESRD networks engage with. So we do conduct an annual meeting that happens every year, and it's really about what you need to know about CMS priorities, goals, and quality improvement, and how it impacts your dialysis facilities, as well as the patients in which you care for. So this meeting is being recorded and the slides are being made available on the network website. As mentioned, I have dropped that link in chat. If at any time somebody is joined and they don't have that link and you need it again, please just ask in chat. Happy to continue to drop that if you've missed it. I thought all lines have been muted to avoid background noise, but it appears they might not have. So I just ask kindly anybody who is online, if you can mute your lines just to make sure that we can allow the speakers to be able to be heard. We're asking everyone to be present and engaged throughout the presentation, and that we want you to actively share in any discussions using chat. So if you have questions, please submit them in chat throughout the webinar. They can be submitted at any time. You don't need to wait at all, and there will be opportunities. Either the presenter can address some questions, or the chat is being monitored by our team, and we will make sure that the team is responding to those. Again, if you're not on, if your mic is online, if you can just mute it, that would be greatly appreciated. So I just want to a couple of meeting reminders about our agenda today and what we're going to be discussing. So the objectives of the webinar is really to provide an understanding of the scope and role of the IPRO ESRD network program. We want to be able to explain some of the national ESRD initiatives that are outlined in the Executive Order of Advancing American Kidney Health, the conditions for coverage, and what we refer to as our ESRD statement of work. And those things include providing an overview of our current quality improvement activities. They're called objectives and key results, and identifying opportunities of how to foster patient and family engagement at the facility level. We'll go into some of the requirements for the health equity and culturally and linguistically appropriate services, or CLAS, patient services, and how we can assist patients with any type of grievances or patient experience of care. We want to explain how CMS expects facilities and the networks to operate with emergency preparedness and management protocols. And then also we'll go into helping with access and utilization of the CMS ESRD data management systems, and how you can also better engage with the network. All right, so I am going to turn it over to my colleague, Sue Capone, who is the Vice President of the ESRD Network Program and also the Executive Director for both Networks 1 and Network 2. Thanks, Sue.
Thank you. Good afternoon, everyone. Wow, what a turnout we're having. We're at like over 370, so welcome, everyone. We are thrilled to have you. I'm going to present a small overview in the beginning of the presentation, and then there'll be subsequent departments, quality improvement, patient services, and data. I encourage you to stay on for the entirety of it, because each section is so important, and we don't want to miss all this good information we're going to provide. So a little bit about us. We are a quality improvement organization, and we are celebrating our 40th anniversary this year. We are We have been the Quality Improvement Network QIO since 1989. That was a major piece of the work. And we've been an ESRD network since 2006. And in 2006 is when we started the ESRD work in New York. We also are an IPRO contractor in 11 states. We do independent review in 15 states, and we have more than 500 physician consultants on staff. We also have more than 350 employees, which include nurses, physicians, epidemiologists, and all of that's listed here. As far as the network, we have many staff that came from dialysis units. So when you're talking to us, we've been where you are. So we have nephrology nurses, nephrology social workers, and a great deal of experts on our team. We are quality experts, evidenced by our work in 33 states. We are URAC accredited and ISO certified. So our mission statement from the time that we began our work in 2006 has been the same, and that is to promote healthcare that for all ESRD patients that's safe, effective, efficient, timely, equitable, and patient-centered. So this is the administration team, and each time we change a department, we'll introduce you to the team members. So as Danielle, that is me. I've been introduced. I'm the executive director also of Network 1 and 2. Vicki Cash is the executive director of Network 9, and I'll outline the numbers if you're not sure which network you're in. But Vicki also leads the quality improvement work across the 4 network contracts that we have across the 13 states. Danielle Daly is our patient services lead and our incident commander. And Laura Edwards is our go-to for everything, our contract manager. And if you've called the network, you know Laura. So a little bit about our work for the people that don't know. We are on a 5-year contract, 5-year statement of work. So we get what's called a base year and then 4 option periods. So we are in the option period 3, which means we're at the 4th year of our contract. So we work on all our quality improvement goals, and those goals are given to us in a statement of work by CMS. They don't tell us how to do that work, but they tell us what they want us to achieve and what they want us to have facilities achieve. So we deploy all kinds of interventions for dialysis transplant centers. We work in focus on health equity and focus on vulnerable populations. And the past year, now going into this year, we have had a large focus on on-site visits for 2 dialysis facilities, and we have a technical assistant team that's been reaching out, and I think we've made over 400 visits in this past year. So we had a little bit of a change in this period. Every year in that option period that I mentioned, CMS gives us the statement of work and sometimes tweaks with some changes. So this time they've removed some measures and all our work measures in nursing homes, depression, telemedicine, and the 2728 measure that's greater than 1 year. And we'll go into those. You might touch on those as we go. But there are 18 quality improvement goals in this period, in option period 3. So a little bit more about us, and then I'm going to cut to some of what the responsibilities are. So these are our networks. We have 4 ESRD network regions. Network 1 is one of the smallest network in the country with almost 15,000 patients and 200 dialysis facilities, 15 transplant centers. Network 2 is a little over 28,000 with 360 facilities. A little something that's different about Network 2 is that Network 2 has a great deal of independence as opposed to some of the other networks. Network 6 is the largest and one of the largest networks in the country with over 50,000 patients and 772 facilities and 12 transplant centers. That's a huge area. And those areas are, as you can see on the map, North Carolina, South Carolina, Georgia. Network 1 is just New England, and Network 2 is New York. Network 9 is in Indiana, Ohio, and Kentucky, and there we have a little over 32,000 patients, a little over 600 facilities, and 13 transplant centers. And we'll be talking about this. So this is our total. So we oversee about a little over 25% of the ESRD population in the country. So we wanted to touch on so that everyone knows, and sometimes people don't know. Sometimes they just see emails from the network and say, okay, this is what we have to do. But we wanted to give you a little bit of background before we dive into the projects. of what our responsibilities are and then what your responsibilities are. So in our network responsibilities CMS wants to see us collaborate with the community, get community partners involved, and focus on quality improvement. We also bring feedback to CMS, so what's working, what's not, what maybe patient issues are coming back to them, and they want to hear that, and that's part of our job. We also encourage patient engagement, and we talk about that through our technical assistance visits. We have a team of social workers that work across these 13 states, and they evaluate and resolve patient grievances and access to care issues. We also collect data and measure the quality of care. All that data, the data work we do is tremendous, and it supports every part of our quality improvement work and emergency preparedness and disaster response. And Julia will touch on that. So part of what your responsibilities are as part of the conditions of coverage is to participate in network quality improvement activities when requested. Inform patients of network resources, including grievance resolution, education materials, and peer-to-peer mentoring. Notify the network of any major events. If you have any disruption of service, you're required to contact us and let us know. We've had a flood. We're going to be out tomorrow. We're going to close tomorrow. We've rescheduled patients. That's normally what we need to hear, and that's what CMS requires of us to inform them of. And what's also required is to respond to any inquiries that we ask and requests for information. And we try to be patient because we know that you're all struggling and staffing is tough. But we really try to be sensitive and respectful of your time. We also ask that you submit data in a timely manner. This is really important. Data submission impacts your facility's quality incentive program scores and overall performance measures. So we also ask you to bring to us any barriers and challenges you may have, and keep the personal information, your personnel information, updated in our information management system. So we send out, once a year, we send out a collaborator survey, and I don't know if any of you have seen it, but I hope you have. And it goes out probably in a couple of weeks, maybe in August. Maybe it just, yeah, I'm sorry. I didn't know that was making noise. If anyone can mute. So we send that out in June, and we sent it out in June. We get the results back in August. From when we send those results, when we send those questions out, we want to know, what's working and what's not. Have you received this information? Are you using this information? Is the staff being responsive to your needs? These are all things that we get the results in August, and then we kind of take that in and kind of look for how can we improve that? How can we improve our service to you? So we look at customer satisfaction, technical assistance, the help desk support, and patient and family engagement. So what we've done after we looked at that is where we developed a plan. So we are launching, we've received a lot of comments back that sometimes look like the people that are answering it don't understand everything that we do on our end. That's why this meeting can be helpful, but we're also creating a video that we're going to have on our website and we will send out that hopefully you can use for new staff, whether that's new managers or new staff, just to let them know this is what the network is and this is what it does. It's not a long video, but it might be helpful, and we're hoping that you use it. We're also, based on your feedback that you couldn't find some things on the website, we are beginning to redesign our website. We've also developed a toolkit, and the toolkit is the title is Empower Yourself, a Facilities Guide to Connecting and Knowing Your ESRD Network. This was built mainly by the team, our improvement team, but also the team that goes out and visits facilities. This is what's missing. This is what people don't have. This is what people need to know. So we are hoping when that toolkit comes out, and we're releasing that in July, we're hoping that that will be useful and a very useful resources, not just for nurse managers, but anybody working and running the unit. Okay, I'm going to pass the ball to Vicki Cash. Vicki, as I introduced before, is the Executive Director for Network 9 and also runs the quality improvement work across the program. Vicki?
Thanks, Sue. Can everybody hear me?
Yes.
Oh, great. All right. So quality improvement, it's what we're all here about. CMS is your major payer for dialysis, and what they contract with us, for many of the things we talked about, but one of the biggest things is making sure that the quality of care that's delivered to ESRD patients in any population, transplant, dialysis center, home, is at the standard that they expect and anticipate. So that a big chunk of our work is on working on some of those improvement areas that CMS outlines. And we've got a really robust team to help us. Let me start by introducing that team. So the first two bullets on your left and right of the slide are the on-site people that Sue mentioned. These are the individuals that are, scheduling appointments and coming out and seeing facilities. We do have some guidelines from CMS, so they do come to facilities that are more in an area. They use an index called the Area Deprivation Index, and it points to facilities that probably have more challenges with social determinants of health. So, housing, food insecurity, education levels, multi-generational families, English as a second language, on and on. So those things really kind of dictate, some of the areas that are, in this area deprivation index score. And those clinics are the ones that we're trying to get into and see. And this group has been leading a great effort and been out there to see 400 facilities across the 13 states we manage. The two ladies at the bottom of the screen are the two assistant directors in our ESRD program. They have primary lead roles. So Katie Chorba is a nephrology nurse, our assistant director, and she runs the hospitalizations project, but she also manages all the cases that come in that are termed a clinical care case. So this is a case where a patient believes that their blood pressure wasn't treated the right way, something of that nature, and we need to look at it from a nursing medical perspective as to what happened. And then Carolyn Sanner is an assistant director who leads our whole transplant project lead area, and she also works very heavily with areas like patient and family engagement and health equity. So the next group of people on our, I'm losing my, there we go. The next group of people in the quality improvement team are all of our individual project leads, and this is a really great group. We have Aisha Edmondson. She's our project lead for patient and family engagement. So she works closely with the patient advocates that we have and our PFRs, as well as with all of you at the facility level. Yvonne Heavner is our project lead, and she works with trying to really develop an outreach to CKD educators, but she's also working with the Home Project and doing some work to help new patients start onto dialysis. Michelle Prager is our project lead that does work with home modalities, and she does work with our transitions to home. And then Tiffany Reese is working on our healthy living lifestyle, and that includes the vaccinations, because actually part of being healthy is getting all your preventative health care. And then Stephanie Roy, who's our health equity specialist, and she really focuses on class. So that's the quality improvement team, a great group, lots of different backgrounds and specialties there. And they're managing the work on all of these different areas. There's one area here that's mentioned, which is our data quality improvement reporting system, and that is managed by Svetlana, who you'll meet later, who's in charge of all our data. But you can see we try to give you emblems to recognize all this different work. And as Sue mentioned, there's a number of kind of big buckets of goals on this slide, but there's multiple different metrics we use to measure success in these areas. So it converts to about 18 different metric goals that we are looking to improve based on the numbers of increase that we need to do in an area or decrease that CMS asks us to do. So, for things like getting more patients transplanted, getting more patients at home, we have a goal to improve those numbers. And then for hospitalizations and emergency room visits, we have, goals to reduce. And you guys, we send you out report cards and a lot of information about that so that we can try to work together on these very important quality improvement areas. So how do we do what we do and what do we attempt? Well, there's 2,000 of you, not at individual, but 2,000 facilities out there. And you saw there's, probably about 15 of us. So the numbers are big, and we have to work very effectively. So we really take a multifaceted approach to trying to spread quality improvement. Some of the things are very one-on-one. We'll have facilities call us. We'll work individually with people as they request or need. We do also reach out to facilities that may have numbers. We go all spectrums. So people who are performing strongly, we want to know how you're doing it, what you're doing, how we can share success and really spread that. If you're struggling and there's areas that you're not improving, then we're trying to reach out and talk to you. And we call it technical assistance, but those are providing resources, maybe linking you with an education session or things of that nature to help you really work on data outcomes. Monthly, for everybody out there, we do have those IPRO Learn interventions, and we really listen to you when we've tried to ramp back on the amount of those, but we'd love a team approach. So if something is more transplant related and the transplant person in your facility is the social worker, she does that activity. If something is more home-based related and you have a home nurse that leads a lot of things, we get that home nurse in charge. So we know that we can't overwhelm you with activities, but it's our way of sharing current news, updates, different interventions and resources that you could help you improve in those different areas. We do offer a series of calls. So we ourselves, the network, offer best practice calls, and we work with groups in a community coalition and MRB on a biannual basis. But there's also some national calls that happen quarterly, and you'll see these invites come out, like a Learning in Action Network call. Those go out to you. To participate in and they have national level speakers, and those they're kind of cutting down on some of the frequency of those calls. So hopefully you'll be more able to attend those, and we push those out through IPRO Learn and also through some email communications. So watch for those communications. Those are all great calls for you to learn and improve your practice. And then there's this call that we do annually where we try to loop you in to who we are, why we do what we do, and how we hope to interact with you. So I wanted to talk a little bit about IPRO Learn because it's a major way we're hoping to support you with quality improvement. So, you have the 3 different sections of IPRO Learn when you log in. The first section is really about what's new and what recent announcements. So we try to put all the programs that you might find helpful, any deadlines. So if there's changes in EQRS documentation that's coming up, your equipped performance scores preview is coming up. All of these announcements get logged in there. So it's really good to scan these routinely and make sure you're staying current. The other section then is what we call your to-dos. And we really have tried to focus in and reduce the amount of those and just give you some very effective areas that you can, maybe learn something new about home, see a new resource you might want to put into your toolkit, or maybe you just read an article that helps you understand better how, a health equity issue is affecting an outcome. And then lastly, we have our area where we do have a toolkit, and this has all the resources that the network has vetted, as well as some national resources that are very good in that area or domain of health and quality improvement. And there's also a forum there, and we love having discussions that you guys can provide information about something you've done, a best practice. Sometimes we'll put some kind of a challenge out there and see what people have done to overcome it. So, the discussion forums are a great chance for everybody to share, and you can read the answers too and learn yourself from those forums. So I just wanted to move to a polling question, and we, again, kind of following Danielle's lead, to put your answer in the chat. We're curious to know, have you ever used any of the activities that we've put out there in IPRO Learn, or maybe one of the resources at your facility? So if you could just give us a yes or no, we would love to see kind of where you stand with that, and if you've been able to get in there. Oh, I've seen lots of yeses, so you're making my heart happy. Thank you so much. You're always a little trepidation when you ask these questions, because if you're overcome with no's, then you feel pretty bad, but this looks great. All right. And we are, again, continuing. And great reactions. Thank you. We are continuing to look at how to make that the best possible resource. And we definitely heard that too much was in there before. So I think you'll see June, I think we had like 3 or 4 activities. So we're trying to trying to just get it into, something concise and good for you to use. All right. I'm very, very, very glad to hear that. What's another way we try to connect with you? So I did include our performance reports here. So we do try to send you out. And I know you have different goals for your facilities and different outcomes you're looking at. And sometimes these numbers, our year is different than your year. So it's a lot to keep track of. And I totally understand that. But what we do is try to send you the numbers that CMS is hoping that we hit. And remember, because you're all funded by CMS, they're really looking at being your major provider. They're really looking at you meeting their goals and showing that improvement. So it's a little bit of a balancing act, I understand, but if you can incorporate these goals into the goal work that you're doing at your facility, I think that's the best way, and try to see if you can kind of move things along. We'll send you these reports. We try to tell you, what patients you're missing. We actually give you the UPI number so that you can, dig in and try to find a person and say, oh, this is a person I need to start working on to transition them to home because they're, or I need to get some more vaccinations and this is the group I can identify. So those performance reports are something we release every month, and we have new data now. I don't think they're going to come out until July because we like to give you like a 2-month baseline, but please watch for those in your email and use them at your QAPI and try to blend them into your own quality improvement program. And then I just did some screen prints of the different types of calls. So the top bullet there, or top item, is the best practice call that we had some great speakers on. And these are people like you out in the facility, just did great work, worked with us on a community coalition, and really did a nice root cause analysis, put a plan to study active in place, and came up with some better results. And they share how they did that. So sometimes it's just good to hear from your peers about what they did. And then there's an example of the Learning in Action Network that we, the national team that will come out there with their calls. And then we do a lot of targeted improvements. So that's kind of the broad brush of how we try to reach all 2,000 of you. But then we also do some very targeted work, and that's with our community coalitions and our on-site visits. So every 6 months or so, we'll pick a group of facilities. And again, these might be high-performing, low-performing facilities that we, based on their demographics and their past performance, we enroll them in a community coalition. And we ask them to really participate very actively with us, trying to figure out a problem that they're trying to solve and how they would put a plan in place to solve that problem. We've been tagging those community coalition facilities with our on-site visits, so you get some additional support. So some of those great folks you saw in the beginning come into your facility and try to talk through some of the activities and what's going on, maybe help you with your root cause analysis, help you with your plan, do, study, act. So this is like an extra support for you. And then we try to, engage you for that whole 6-month process. Like, what did you put in place? How did it work? What are the outcomes that you're seeing? Sometimes things don't work. If it doesn't work, what are you going to retry or do? So it's a long and continuous process, but I think if you just take the simple act of, taking that plan, do, study, act and following it through, most people have found that attention has improved their outcome, and they learn something from it they can permanently put in place or sustain. And a big part of that is get your patients involved. They are very knowledgeable. Many want to help, at least maybe limited while they're there. But I think we're often afraid of reaching out for that resource, but they can be a huge support. They can help you do bulletin boards on home. If they are strong advocates, they can advocate for vaccination. And we work with the patients often, and we hear that they're not often asked, that they're often not even encouraged to participate. And that breaks our hearts, because we really know there's such a strong influencer in your facility, and can be a real reciprocal relationship for you. So that's our targeted approach. Here's a little bit, and I'm sure if you've ever been on a coalition, you've seen our 5 why root cause analysis. There's a really great video, but it's digging deeper. Like, telling us that patients aren't interested in home, that's not an answer. And it's home, why aren't they interested? Is it because they don't get enough education? It hasn't started soon enough? Why didn't it start soon enough? You've got to go down that tree. Well, we don't have an in-place CKD educator. Why don't we have an in-place CKD educator? So, I'm just trying to give you an example, really digging in and trying to come up with a major root and not just stopping at the first thing that you think of. And then after that, once you kind of got to that kernel of truth, that's when you got to put it into the plan, do, study, act cycle. So what can we do about this? Like, this should be an all-in effort. You guys should talk about this at QAPI. Like, how can we fix this? What can we change that would make this different? Could we tag somebody to be a CKD educator? Would the doctor refer to that person? How would we do? And then maybe try that. See if you could get somebody in place, get them trained, give them some materials, have that doctor refer, and then see if it makes a difference. Are there more home referrals starting to happen? Are people more interested when they walk in the door to talk about home? So that's the quality improvement process, as simple as it sounds. But when you do something very methodic like this, you can and will make a change, and you'll see improvement. And then, our on-site technical assistance, I just want to take a minute to talk about that. This is not a punitive. This isn't like watching what you're doing or regulatory, trying to check you against the conditions for coverage. We are there to help you. We are there to talk about how to be involved and engage with the network. We're there to provide assistance, help you mitigate barriers, and really stay focused on, some of the improvement that needs to happen. We're talking a lot now about health equity. So health equity is a big area of focus because, we know it drives a lot of outcomes in the dialysis setting. So that's a little bit about the overall approach to quality. I'm going to turn it over to our assistant directors, Katie Chorba and Caroline Sanner, to kind of give you a little bit more of the details about the individual goals.
Wonderful. Thank you, Vicki. All right, so we're going to get started with giving an overview of the transplant project. So under the transplant project, the two goals are to increase the number of patients added to the kidney transplant waitlist and increase the number of patients who receive a kidney transplant. We have on the screen some interventions that we previously released to the community that are representative of our current goals and some of the focus that we're currently putting out to you all at the dialysis facilities. The first one is understanding better than dialysis kidneys, or those high KDPI kidneys related to transplant. And the second intervention is IPRO's Kidney Transplant Compare app. This application is a patient-facing application that strives to allow patients more autonomy in selecting a transplant center that is best for them. So if you're not familiar with those resources, definitely check them out on our website. The second goal area is patient and family engagement. We have three focus metrics in this area. The first is to increase the number of facilities who integrate the patients or family members into QAPI meetings. So integrating the patient's voice into the QAPI meetings. The second goal is to increase the number of facilities that assist patients in developing a life plan. And the third is to increase the number of facilities that develop and support a patient-to-patient support program. Are the slides moving now? Yes, okay. Sorry about that. Patient and family engagement interventions are on the screen currently. The first is the Help with HIPAA guide. So as I went over those goals, you might have said in your head, oh, we don't have patients attend our QAPI meetings because it is a HIPAA concern. Well, this guide talks you through how to engage the patients and avoid HIPAA. We do have a patient facility representative alliance manual. So if you have patients that are more high speed, that are really great advocates at your facility, this manual shows how you can get your patients involved in more quality improvement activities with the network. The third is a guideline on how to include those patients in the QAPI meetings, and also a best practice guide. The third goal area that I'm going to cover is health equity and class. So the goals for health equity in class are to deploy interventions to the entire patient population to reduce your specific health equity barriers that you have at your facility. We want to improve communications in areas such as low health literacy, work with dialysis organizations to implement national class standards. CLASS stands for culturally and linguistically available or appropriate services. CLASS are services that are respectful of and responsive to each person's cultural and communication needs. So it's not just, do we offer an interpreter? It's much deeper than that and much bigger of a focus than that. And the fourth goal is to assess the facility's commitment to health equity using 5 attestation domains. On the screen here, you see 2 intervention approaches for CLASS and health equity. Throughout the last year, we did put out CLASS modules to teach the facilities a step-by-step process on what CLASS is and what it really entails, because this was a new concept for a lot of the community. And then the second intervention is called My Fast Food Plate. And this is to address social determinants of health related to low income and access to food to support a kidney diet. And what we did here was looked at food that is widely available, which happens to be fast food, and how patients can make decisions that are more appropriate for them based on the kidney diet guidelines. And the third or the fourth goal that I'm going to go over are our data goals, the 2728 and 2746 forms. So CMS is continuing to closely monitor the timely submission of the 2728 and 2746 forms. There are resources in IPRO Learn and also monthly EQRS newsletters that are available to train staff to improve the facility's timeliness and compliance of these forms. It's an area that we are continuously working to ensure that we are getting the forms in complete and on time. It's important to make sure that staff are signed up to receive the weekly lists of forms due in EQRS. So not just one staff member, but all staff members that have a role in getting these forms in on time, and then submitting tickets to us as a network, specifically to the data team, to assist you and getting these forms done and to help educate you if there's any uncertainty about how to do the form the proper way. And I'm going to hand it off to Katie Chorba to pick up here.
Thank you, Caroline. So we're going to go over a couple more goals. Our first one is improving education and access to home modalities. So our goals here are to increase the number of incident patients that are starting to a home modality, and to also increase the number of prevalent patients that are transitioning to a home modality. So these incident goals have changed. So we are asked to achieve a 15% increase in these numbers, and the data for this goal will be re-baselined this year. An incident patient will now be defined as a patient starting home within the first 90 days of starting dialysis. So our prevalent goals have changed as well. So we are asked to achieve an 8% increase. The data for this goal is also going to be re-baselined. And any prevalent patient is a patient that is defined as being beyond 90 days following their first dialysis start date. Some of the great interventions that they have shared this year is seeing yourself in a positive light with a peritoneal dialysis center catheter. This resource is really great in having patients see different sides of how the PD catheter is not a hindrance to them, and how they can have the PD catheter and really go on with their life and provide that home dialysis treatment. The next one is, how old is too old for home dialysis? The facilities had seen some patients that were saying that they were too old to go home to home dialysis, and Michelle was really great and was able to provide this great resource to the network service areas. Our next goal is to increase vaccinations throughout our patients and our healthcare facilities or staff. So our goal is to increase COVID-19 for not only staff, but also our patient population. We also want to increase our influenza for our staff and for our healthcare providers. And then we also want to be increasing our pneumococcal pneumonia vaccines this year as well. We have some really great resources. Get the vaccine you need. This goes over different vaccines that are provided and why the patient should be having them. We also have another resource. It is called, Is it the flu or COVID? And it breaks down the signs or symptoms and helps the patients understand what they might be experiencing. And lastly, we are looking at our decreasing hospital admissions, our 30-day readmissions, and our ED visits. So the goals here are to decrease these numbers, and it is based on data off of Medicare claims, and they are also based off of diagnoses defined by CMS. And then throughout the year, we have done a few different interventions as to what type of care do I need. This resource provides multiple signs and symptoms that a patient may be facing, and then providing what kind of care they may need to go to based on those signs or symptoms. We also have shared with the network service area, the CDC, protecting yourself and your family from sepsis. And then we also provided a health literacy barriers and strategies to decrease in acute incidents CE course this year.
Thank you, Katie, and also Caroline for providing that background on some of those projects. A couple of links have been dropped into chat, so just want to make sure to keep going back to chat and find links that are available about either things that are being presented or even how to engage with us. So again, my name is Danielle Daly. I'm one of the executive directors here, and also am in charge of emergency management with leading the team. I want to go through some basic overview about patient services, who our team is and who to contact. I have dropped in chat both our program website as well as a link to all of the staff. But want to introduce our fine staff in the patient services department. And also, please note some of the phone numbers and contact information here. If you're not pulling it off of the actual presentation itself, that you can write those numbers down. This patient phone number, patient services team phone number, is how to contact any of the patient services staff if you have an issue with a patient, whether it's a grievance situation and access to care. We encourage you to use that phone number, and faxes are only sent to us in a secure capacity with the number that's provided here as well. But these numbers that are available here will get you to any one of our wonderful social workers. So want to introduce Shazina Andiapan. She is our patient services specialist for the Network 2 service area. Brooke Andrews is our patient services specialist for our Network 6 service area. Stephanie Cole helps address grievances and phone calls for all of our service areas, but she also does some community outreach work in how she will send messages out to the community, as well as Julia Gessick, also a patient services specialist, but she deals with emergency management, and we'll talk a little bit more about that. Liz Lanez is our patient services specialist for our Network 9 service area, and Agata Roskowski is our patient services manager for Network 1 and helps to oversee the program. I will say that all of the individuals you're seeing here will be answering that main phone number. They all intake grievances and access to care problems for the entire program, all four network service areas. So you can reach any one of these 6 individuals at a time. But if you are looking for your specific network service area person, that's why I had indicated who those individuals were. So the network does encourage that providers promote a safe and quality care for individuals with ESRD, but it's also important to include efforts to improve the patient's independence, quality of life, and also rehabilitation. For many years, I think that voc rehabilitation and employment networks were thought of programs for individuals without a disability. And today there are people with disabilities who are finding that not to be true. So listed here on the screen, there are many organizations and programs available to patients with ESRD. to help assist them. The first one that's listed here, though, is really the one to note, because the Social Security Administration Ticket to Work program can help provide some of that information to patients about returning to work without losing their disability benefits. So I know that's something that is a great concern as we're promoting things such as transplant, as we're promoting things about home modalities. There's also an opportunity here for patients to gain more independence, and some of these resources are available to them. Also listed here is the Job Action Network, the National Kidney Foundation's Returning to Work While on Dialysis program, Life Options Rehabilitation Program for Employment, the Kidneys Patients Guide to Work and Paying for Treatment. And then there are additional resources for voc rehabilitation on the IPRO ESRD network program website. All those links are here. Again, if you are following along with the presentation, the PDF version of the presentation has active links. So I do encourage you to access those links and be able to share those resources with patients. Also in the patient services department, we deal with emergency preparedness, whether that's preparedness, mitigation, and response. I want to tell you a little bit about the network's responsibilities. So the ESRD networks are the foundation of CMS's emergency management structure. We work in collaboration with a national contractor, much like how ESRD networks are national contractors. This one is called the Kidney Community Emergency Response, and it's a coalition. The network monitors conditions that might impact facilities and their ability to provide services to dialysis patients. And then we work to mitigate the risk, provide technical assistance to help develop comprehensive emergency management plans for the facility as needed. We've established many relationships with state emergency management officials, also healthcare coalitions, and they're really, those relationships are put in place to help support the local facilities and local patients. So I'll go into just a moment about how you can communicate changes with us, but if at any point in time something is identified where you need an additional resource beyond your own capabilities, please come to the network as a collaborator and a partner to help with that process. Because during an emergency event, we work to identify any of those challenges and barriers impacting patients and facilities, and we want to make sure that we can collaborate with the emergency response stakeholders at the local level to help reestablish interrupted services as quickly as possible. So just a little bit background for kind of what is an emergency, and they could be local, they could be state level, regional, national. I know in many of our territories, snowstorms is a problem that can take out an entire area and really impact transportation. But these are just some basic things about what is considered an emergency. So if it impacts the type of service, whether it can be delivered or altered at all, things would be like water or power or something to the building. Public health issues, we were dealing with COVID-19 for many, many years. Weather events, as I mentioned, a snowstorm, man-made events, whether it's terrorism, active shooter, or saline shortages, transportation. We've had a bridge collapse that's been in national news, or if a company, a transportation provider has closed, or if it cripples any of the communication situations. We want to make sure that we're able to provide support when those things do occur. So I do have a couple of QR codes up here. Again, if you don't have the presentation up where you can access the link, the QR code and the link are going to get you to the same place. If the facility's normal schedule is impacted by an emergency event, and the facility has altered their schedule to some degree, it's important that you report this information to the network. So there is an emergency operational status report. There is a link on the web page. So you are seeing here a screenshot of our landing page for our website, and it's circled where that report is. However, again, there's a QR code and a link here. So during an event like this, we're hoping that the facility is preemptively, if they can go in and use this link to report information to the network, which will help us to inform our partners, CMS, and any of those collaborators on the impacts that will change treatment for ESRD patients, and make sure that we get the right sources of resources to the right areas at the right time. However, even though you have responsibility to report this to the network, you should also be communicating directly with the Department of Public Health about any interrupted services. But just wanted to take an extra moment to be able to provide that link. to everyone, or the QR code. So facility responsibilities. We do something annually in September called the Critical Asset Survey, and that we request that all dialysis providers in the network service area complete this survey. It's conducted through our learning management system, IPRO Learn, so you will see that in September, but it can be updated at any time using the IPRO ESRD Facility Information Management System. And Svetlana will talk about what that is. That's how you can update your records, you do your agreement of participation, but there is also an area to be able to collect that throughout the year without doing it in September. And then facilities can also print the critical asset survey summary once it's complete. And we're encouraging you to put that into your emergency management plan. Now, the purpose of the critical asset survey is to identify key contacts and facility capabilities prior to an event. And then the results of that survey are shared with state and local emergency management officials and regional healthcare coalitions to support those efforts, as mentioned earlier. The responses provide information to help maintain or reestablish facility operations, assist with emergency management leaders in making decisions on the placement of resources, and again, ultimately to ensure that access to care for dialysis patients. And then additionally, the detailed information is also shared at the state level with the state emergency officials. And so to make sure that any gaps in service can be prepared for and to be put into place. So we do encourage facilities to be involved at your local emergency preparedness activity level. So if you are not connected with your healthcare coalition, if you are not connected with your Office of Emergency Management, please reach out to them, say hello, and make sure that they know that services would be needed for ESRD patients should there be some kind of service interruption. For those who are not aware, we do have an emergency, an ESRD emergency hub mobile app. This is a place where there could be alerts that are provided in real time. I'm hoping one of my colleagues can drop any links to the page on our website in chat, but the next page also does have some QR codes. It's a resource that was developed in collaboration with the South Carolina Low Country Healthcare Coalition. So as I mentioned before, these healthcare coalitions can be extremely beneficial. There was some funding that was provided to IPRO in order to develop this app. It has really helped in times of critical situations. There are free resources on here. You do not need to pay for this app to subscribe. The information is all about how everyone can stay safe and healthy during an emergency. It can be used on a smartphone or tablet. There is a place to be able to store information for patients about their treatment. Evacuation information is provided on this app, any kind of phone numbers for different organizations, whether it's the network, Fresenius, DaVita, fill in the blank of the different organizations. And we also do push out alerts, real alerts, almost like a blog post. So I just want to show some of the key features, and here are the QR codes. If you have an Apple or a Google or Android device and you want to get on that emergency app right now, I do encourage you to scan the right QR code here. But see, these are some of the big features of the notifications. You can set up a notification based on your own territory. If you live in Connecticut, then you can request only getting notifications for Connecticut. If you live in Indiana, same thing. You can really specialize where you're getting your notifications. The organization contact information. There's something called the vital dialysis information for patients. It's where prescriptions can go and checklists. All of that information lives just on the individual's device. It is not something that is stored anywhere. A to-go bag or checklist of things to have, 3-day emergency diet information, where shelters are available, and then any kind of severe weather information can all be found on that emergency app. So I'm going to go one more page in. So if you haven't gotten that scan, that QR code, just make sure that you come back to our presentation to do it. So we do have some staff and patient education. There are flyers that are on our website, and we're hoping that those flyers to educate patients and staff about that mobile app and get them registered. We hope that you can post them in the facility. They look as what you're seeing on the screen here. We also want to make sure that there is some discussion that's happening between the staff and also patients about what the resources are available in that app and why it could be beneficial. There's a 3-minute video for that app. I've posted the YouTube link here in the presentation, and we are hoping that that could be something that could either be streamed in the lobby on the TV there, or maybe chairside, just a way to get that app available to everyone. I'm going to turn it over to my colleague, Agata Ruskowski, who is our patient services manager, and she's going to tell you specifically about patient experience of care. Thanks, Agata.
Thank you, Danielle. Good afternoon. I'm Agata Ruskowski. I'm the patient service manager for the Network 1 area as well as for the network program, and I am overseeing all the social workers within the network program area. So just want to provide a full overview of the patient experience of care and the work that all the social workers are doing within the network program area. And that is to improve the patient experience of care and providing education to patients and dialysis facility staff about the role of the network by resolving grievances when patients are outreaching to us, and addressing access to care issues when patients do not have access to an outpatient dialysis center. We also provide a focus order of all grievances and access to care cases. And those orders, we are sharing that with CMS to share the trends that we are seeing, as well as providing and developing resources to address areas of concerns. We also provide case review responsibilities where we investigating and resolving grievances filed by patients or patients representative, and addressing their concerns and providing resolution not only to patients but also to the facility staff with the strength-based approach focus. So as the network role within social workers and representing the entire ESRD population, we are facilitators where we mediate concerns raised by patients and facilities. We are expert investigators where we investigate concerns raised by patients or authorized parties that represent patients with the proper consent to represent the patient without breaking the HIPAA compliance. We are educators where we provide patients and facility staff with tools and resources to improve the overarching goal of patient experience of care. We also provide advocacy to patients and to ensure that access to care is available to all patients within the network program service areas. We also focus and we play a role as referral resource, and we provide patients and facilities with all sources and all supportive services in the area to address any concerns. And we also take a role of being a quality improvement specialist, where we support the improvement of facility process to improve the overall quality of care for patients once they are outreaching to the network. So within the grievance aspect and the network role, once a grievance is being filed by a patient or a patient representative, we classify those cases based on the level of concern that is being reported to us. We may classify a case as an immediate advocacy case, where a quick resolution can be provided and would be provided to the patient. And to resolve those cases, we do have, as per CMS guidance, to resolve those cases within 10 calendar days or less. And that would include us giving some of examples, patients outreaching to us with a concerns that the unit is cold and they feel extremely cold while receiving dialysis. We would then provide them with resources and support. How is that they could address those areas of concerns? As obviously we do know that patients do have concerns of being cold while receiving dialysis. The more complex case, which is within 60 calendar days, is the general grievance. And that requires of the network obtaining treatment logs from the facility or any documentation surrounding areas of concerns that are being reported to the network. And once those documents are being received by the network from the facility, we provide a full overview of the documents, as well as provide directives, not only to the patients, but also to the facility if any areas of concerns are being noted, as well as outlining the strengths and interventions that are being provided to the patient by the facility staff. The more complex case involves of a clinical quality of care cases, where patients would outreach to the network to report that the clinical component of their care is not being met, which would, for example, be in areas where patients would allegedly indicate that there was a medications error. And we would, in that situation, involve our nurse from the network who will provide a full overview of the clinical notes and provide resolution as well as action plan to the facility as well as to the patients. And in both of those cases, general grievances and the clinical quality of care cases, we are being tasked by CMS to resolve them within 60 days. If those cases cannot be resolved within 16 calendar days, we would be seeking for CMS to provide us an extension, and we would remain in a full communication with the facility staff. Within the access to care aspect, that's something that we are seeing as a high concern, not only on the network program level, but we also seeing that also on the national level when collaborating with stakeholders. And it's to address access to care of dialysis patients to ensure that they have access to the dialysis outpatient setting, as it is a life-sustaining treatment for them. And the focus is to reduce the utilization of emergency room for dialysis patients to receive their treatment, which is not a sustainable plan. And our goal is to preserve those, preserve the access to care and patients being connected to the outpatient setting. There's different types of access to care treatment and access to care types of cases that we are seeing and categorizing them in a different way. It's when patients are at risk of possibly being involuntarily discharged from the dialysis setting due to numerous concerning behaviors. We would, in those situations, provide support not only to facility staff, but also to patients to address areas of concerns and minimize the challenging behaviors that are coming from patients so they could remain in an outpatient dialysis center. Then we are also tasked with and addressing involuntary discharges. And there's different type of involuntary discharges. Some patients would receive a immediate involuntary discharge notice, or they will receive a 30-day discharge notice based on areas of concerns. And that could be due to non-payment or perhaps patients physically assaulting others at the clinic. And in those situations, definitely there's a full focus on CMS condition for coverage. We are providing that support directives to the clinics based on the reported areas, but we are also seeking for the facility staff to outreach to the network prior of any discharge notice being issued to the patients and providing us with an overview as to what is happening to the facility where we can provide a guidance to the facility staff. And before considering an involuntary discharge notice, just like I indicated, there has to be a full, thorough assessment of the situation. What precipitated such behavior? Why the patient acted in a way where discharge was being warranted? And providing a full overview of CMS condition for coverage. And also, if such notice is being issued, assisting patient with identifying another outpatient dialysis center to prevent the patient of being exposed to the emergency room for dialysis. There's also within access to care, it's an involuntary transfer aspect where the patient will be transferred to another dialysis patient, which it still has to be reported to both CMS and as well as the state. But in those situations, access to care is being preserved and patient will continue to utilize dialysis in an outpatient dialysis center unless patients do agree to be transferred to another outpatient dialysis center. Once discharges can be prevented, that would be a win-win situation for all parties, not only for the patients, but also to the dialysis staff, where dialysis center, where those situations will not be reported to CMS or to the network or the state, but then patients will continue to have a access to the outpatient dialysis center and will be able to further utilize dialysis in an outpatient dialysis center. And those situations are extremely successful. And we do report to both CMS and the state that the facilities were able to prevent and avert discharges of patients. As the network, once we've noticed that and we are seeing that discharges do occur, we had created a guidance of how to prevent involuntary discharges. And if those situations actually do occur, there is a set of documents that we are requesting from the facilities, and we have created such a toolkit for the facility staff to utilize and provide and assess those situations, review those guideline before contacting the network and before discharge is being issued to the patient. We also, as a group of social workers, we also created a lot of educational resources, speak up posters, CMS condition for coverage we're releasing, and we want to ensure that clinic staff, that you guys are utilizing them for the support and to the entire ESRD community. Definitely, I want to make a focus that the speak up posters, we do have them in both English and Spanish. They should be made visible to all dialysis patients and the caretakers at the outpatient center. There's more resources that we have made available to the facility staff of the grievance process and encouraging facility to discuss the internal grievance process prior of patients outreaching to the network and providing resolution to patients. Definitely the utilizations of the grievance toolkit that was created with the use of patients by ESRD forum networks. And those toolkits are also to be utilized by the facility staff. With the access to care cases, and what we've noticed is a lot of patients inappropriate misbehavior and challenging behaviors that they are presenting. We are strongly emphasizing for all of you to review the dialysis patient provider toolkit. There's a full toolkit that NCCA as well as the networks develop, and not only a full DPC toolkit, but also addendum that was created in 2022 with a focus of health equity, self-awareness, how to de-escalate those situations when patients are experiencing challenging behaviors at the outpatient dialysis center. And within the polling question, your feedback is definitely greatly appreciated, and everyone can use the chat to provide us with an overview whether you have a speak up poster available to be seen and viewed by all staff, patients, as well as family members in a lobby.
And Agata and folks on the call, I am going to drop in a link on our website where you can see where those speak up posters are. So if you do not have one in your facility, please go to this area in the website and be sure to download it so you can post it.
Thank you. And that speak up posters not only include the network contact information, but also provides a state specific state contact information, which is required by all clinics to post that in a lobby in an area where it's visible to all parties. I do see a lot of yeses. So if there's any other further questions regarding patient experience of care, feel free to outreach to our team. Great social workers that and assistance will be provided. And I'm going to turn over to the next speaker.
Thank you, Agata. Hi, everyone. Thank you for sticking around. I wanted to introduce you briefly to our data team. You may have already worked with some of us, maybe not everyone. We have Megan Veltman, Sharon Lamb, and Yaming Go, as well as myself, who help do all things data. The first important thing that we want facilities to know is to understand how to prevent security violations when working with the network. CMS and network policies are different from your corporate and internal policies, so please take the time to review and share these expectations so that we do not have to report any more security violations to CMS. All the quality improvement activities you heard about rely on EQRS data being timely and accurate. Patient data is important for Medicare eligibility and patient coverage. Facility data is important for determining facility coalitions and goals for the quality project. And facility staff should have access to EQRS, QIP, and NHSN, all of which are monitored by the network and reported to CMS. Regarding QIP, the final rule for payment year 2026, which uses 2024 data, has already been released. Here's a summary of what is being measured and scored. Some things are new, such as the commitment to health equity, which requires EQRS access to complete. The best way to receive instructions and reminders about QIP, NHSN, and EQRS is to maintain accurate contact information. Here are some links so you can sign up and receive newsletters, emails about important deadlines and any changes to policies. So please make sure that you have access and that you sign up for any listservs that you can. And as Vicky mentioned earlier, network facilities need to log into IPRO Learn to participate in discussion forums, access resources and interventions, and it is up to each facilities team to determine who completes which activity at the facility. Access the IPRO Learn using the shared login and password that we provided. Click on that pretty picture in the middle, and then you can also watch that brief tutorial on how to get started and how to navigate. Another important system that Danielle had mentioned that facilities should know about is the contact management system. Here, anyone at the facility can update and download the facility network agreement that is required when the state surveyor comes around, and also to complete the critical asset survey to notify the network of any closures or interruptions of services and to request assistance with those situations. Facility staff can log in at any time and add, remove, or update contact information so that your teammates can receive important network emails, such as the quality improvement report cards, such as the weekly EQRS cleanup reports, and also newsletters, invites, and emergency updates. We hope that you are also familiar with IPRO Help, which is has all the written instructions for EQRS and NHSN that we have come up with so far. We're constantly updating it. We're constantly improving it based on the feedback that we hear from you guys. You can also use this page to submit a ticket so that anyone on our data team can assist you as quickly as possible. And lastly, here are some more important links summarized of everything we kind of talked about today, of how to get there, how to request help, how to sign up. And really lastly, if you could answer one more polling question, please. If you received the latest ESRD data newsletter, which was sent out Monday and Tuesday, we received a lot of bounces on it. So I want to make sure that it's getting to the right people. And if you didn't receive it, please make sure to update your information in our contact management system. Thank you. I'm seeing thumbs up. Thank you. What a relief. And this concludes our presentation of what you need to know this year with CMS priorities. We hope that you found this informative. This recording will be available in IPRO Learn as well as the slides. And we hope that you can share it with anybody that missed the presentation. And if you have any final questions, you can put them into chat. We're here to help. Let us know what you need. We're here to help you.
Thanks, everyone. Before we disconnect, just drop something in chat that there will be an email coming to all those attendees with a post-event survey. The feedback is so important because it allows the network program to develop more educational events pertinent to the needs of our community. So please look out for that. That should be coming soon. Thank you, everyone, and have a lovely afternoon. Thanks for your continued good quality care for patients.